patients, or what we refer to as cancer survivors, have a very, very important role to play. I mean, obviously, they first have to play a big role to look after themselves, I know, in terms of following their doctor's instructions and following up their treatments and completing them, but also, especially when we are talking of National Hospital Insurance Fund cover for cancers, they also first need to make sure they are registered with NHIF. They're subscribing to NHIF before we ask NHIF how much are you going to pay for. So we are calling upon every cancer survivor and their families as well. They need to register with NHIF so that we are able to look at the benefits and benefit from the cover, but also be able to say whether the benefits are enough or not. The other thing that the cancer survivors have a role to play is to take the government and the Ministry of Health in particular, as well as the Treasury, to account. So when we say the ministry is planning to establish 4 regional cancer centers of excellence, we have had that for a long time. Survivors and people diagnosed with cancer have a lot to ask, why has it not happened? We have had this for 10 years. When we talk about access to affordable medicines, the survivors have a role to play to ask Treasury, to ask KRA, are there maybe tax issues that are driving the cost of cancer treatment, of cancer drugs? Are there tariffs and taxes that we need to ask KRA to zero rate to make cancer drugs more accessible and more affordable to patients, because there are many drivers to cost, and taxes and tariffs could be one of them, but patients have an important role to push for zero rating of cancer products and so on. So the other role, of course, they have to play is to educate other people who are being diagnosed and the general public at large that cancer diagnosis is not a death sentence. People are living after cancer treatment for 30, 40 years, a long time ago. We have people who have survived cancer and died from other things that are not cancer. So they have a very important role in terms of public information and education, and also ensuring that newly diagnosed cancer patients don't, take the next flight to India and to other places. Those who have been treated locally and survived for many years need to say, look, we were treated right here in this country by local experts, using the local resources, and we have survived for 15 or 20 years. They have a role to play in also ensuring people don't veer off and start exclusively using some complementary treatments like herbal treatments and other things that we know do not work. So we need patients who have completed their chemo and their radiotherapy to say, look, you really should not stop your treatment to run off to some herbalist who you saw on TV or heard on radio, because a lot of those therapies are unproven. We are pleased as the Cancer Civil Society and also the National Cancer Institute to inform Kenyans that NHIF is now covering a significant percentage of the cost of cancer treatment. And cancer treatments are available in this country. NHIF is coming in to cover that even in private sector. So we're calling on survivors, please register with the NHIF, because we need to tap into these benefits. It is a very, very important development that is going to lift off the heavy burden of paying for radiotherapy and also paying for chemotherapy. So we need to take advantage of this as Kenyans, as cancer survivors, and as a country.